Will the House come to order and members kindly take their seats? The devotional today will be led by Representative Joseph Adriano of Orwell.
Barry Luis, good morning. My name is Joe Andriano, and I stand before you today to honor and remember the 1.5 million victims of the Armenian genocide. Yesterday, April 24th, marked Armenian Genocide Remembrance Day. This date was chosen over 100 years ago because it signifies a horrific moment in human history. The April 24th, 1915 arrest and detention of 270 Armenian intellectuals and leaders by the Ottoman government, who sought to decimate the Armenian society in Turkey. This event marked only the beginning, because about a month later, the Tashir Law was enacted, providing the legal framework for the deportation and massacre of 1.5 million Armenians living in the Ottoman Empire. I never learned about the Armenian genocide in school, and I remained completely ignorant of it until I was selected as a Peace Corps volunteer to go to Armenia and traveled there for the first time in 2011. While there in Yerevan, Armenia's capital, I visited Tiskananaberd, the Genocide Memorial and Museum. The memorial features an eternal flame in a gradually sloping pit surrounded by towering black slabs bigger than this room, leaning inward upon you. And the design invokes a feeling of being drawn slowly into the pit as these slabs collapse upon you. And whenever I visit this memorial, I'm reminded of a story told to me by an Armenian friend of mine about his grandfather, who was a young boy during the genocide, who was forced alongside his family to the edge of a pit by Ottoman soldiers, thrown in that pit, and these soldiers fired mercilessly into the pit, into the bodies, as more and more bodies piled up on top of him. But miraculously, he survived, unharmed by the bullets, and after feigning death in this pit for days amongst the rotting corpses, he crawled out, found shelter, and eventually fled to Iraq. I've heard so many stories like this from my Armenian friends about their incredible resilience and survival during this incredibly dark period of history. And I want to leave you with two thoughts. First, if you're to ever visit the Genocide Memorial Museum in Yerevan, the last thing you see as you exit that museum is a white wall. And on that white wall, there is a single quote in black letters. And this quote says, "Who, after all, speaks today of the annihilation of the Armenians?" This quote is from Adolf Hitler and was dated August 22nd, 1939. Hitler remembered the annihilation of the Armenians, and the fact that the world simply moved on from this genocide with little memory was part of his justification for the Holocaust, part of his reason why he thought he could get away with the annihilation of the Jewish people. And with this devotional, I hope to demonstrate that we do not forget these horrific, dark moments in human history, and we remember them in hope of preventing them from repeating themselves. The last thing I want to say is that at the beginning of my speech, I mentioned why August 24th had been chosen because of the deportation of the Armenian intellectuals on, April 24th was chosen due to the deportation of the Armenian intellectuals on April 24th, 1915. And one of these intellectuals was Komitas, a brilliant Armenian priest and musician who is still revered in Armenian society today. After being captured, Komitas was exposed to such unspeakable horrors that upon his release, he suffered a mental breakdown, severe PTSD, which was only exacerbated by the ongoing persecution of his people. He fled to Paris, where he spent the remaining years of his life in torment, confined to a psychiatric hospital and forever altered by what he had seen and endured. Komitas was known for, among other things, collecting and preserving Armenian folk music. And so I ask that you join me in a moment of contemplation as I sing the closing lines of one of the most beautiful Armenian folk songs he preserved, Chinar Es. In the ending that I will sing, a young man calls out, "My love, for God's sake, do not forget me, even though we are far away." And then the song closes with his wordless sound of lament from being separated from her. And while singing it, I can't help but to think of all the family, lovers, friends, children, parents who never saw their loved ones again because of this crime against humanity. Yakoa Tzvatski Sires Ya Herues Moran Almi Ya nai 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 ya na nai 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 nine, 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 nine. Thank you.
Members, will you please rise as Paige Ziva Baker of Westfield leads us in the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Members, we have a bill on the calendar requiring referral to a money committee pursuant to House Rule 35A. Senate Bill 14 is an act relating to a report on criminal justice related investments and trends. Carrying an appropriation, the bill is referred to the Committee on Appropriations. We have received a request to read a House concurrent resolution that the House and Senate adopted pursuant to the consent calendar. HCR 93 is a House concurrent resolution recognizing April 2023 as Donate Life Awareness Month in Vermont. Please listen to the reading of the resolution.
Whereas the Federal Health Resources and Services Administration reports that despite the 42,000 donor transplants performed in 2022, more than 104,000 persons are on the national transplant waiting list, and every 10 minutes, another person's name is added. And whereas on a daily basis, 17 persons die in the United States while waiting to receive an organ, a number that translates to 6,000 annually. And whereas, according to the University of Texas Southwestern Medical Center, an estimated 450,000 Americans annually need tissue transplants to improve or even save their lives. And whereas Vermont is a leader in the percentage of driver's license holders who have signed up to be organ donors. And whereas on Tuesday, April 25th, during National Donate Life Awareness Month, a commemoration that the U.S. Secretary of Human Services established in 2003, the Vermont Department of Motor Vehicles and the Vermont Department of Health will co-host a celebration of the effectiveness of organ donations that is also intended to encourage Vermonters to designate themselves as organ donors. Now, therefore, be it resolved by the Senate and House of Representatives that the General Assembly designates April 2023 as Donate Life Awareness Month in Vermont, and be it further resolved that the Secretary of State be directed to send a copy of this resolution to the Vermont Commissioner of Health, the Vermont Commissioner of Motor Vehicles, and Donate Life Vermont.
Are there any announcements? Member from Burlington.
Thank you, Madam Speaker. You just heard the resolution honoring today, and in particular, today and this month as Donate Life Month in Vermont. And I want to just emphasize some of the things we just heard in that resolution. As we sit here, there are over 106,000 people, including children, who are on the National Transplant Waiting List. 17 people die each day waiting for an organ transplant. Every 10 minutes, another person is added to the transplant waiting list. Every donor can save and enhance over, can save 8 lives and enhance over 75 more through donations. And in 2022 nationally, over 42,000 transplants were performed. So what's really exciting is the wonderful collaborative partnership that exists between Donate Life Vermont and the New England Donor Services and Vermont's Department of Motor Vehicles. In the past 10 years, while we keep the data a little differently now, I understand, Vermont has gone from being a low state in terms of donor rates to one of the highest. So we roughly went up from about 40-something% to about 56% this past year. And of all of those donors, 97% of the people in Vermont who registered did so through DMV. So we all have had the experience of going to DMV. It's a busy place, and yet they have embraced the organ donor process with such passion and sensitivity and success that it's making an incredible difference. So we are now in the company with Oregon and Tennessee in terms of having rates in the high 50%. We have with us today the Commissioner of Motor Vehicles, the Deputy Commissioner of Motor Vehicles, and some of their fine staff, as well as the Executive Director of New England Donor Services, who has traveled up here from Waltham, Massachusetts, to be with us this morning. And they have such pride in this rate. Colorado leads the nation with 60%. And so I know how much the folks that I'm about to ask you to welcome love a challenge. Let's all do our part to get the word out and take Colorado on and make it 61% in Vermont. So the other thing that's great to know is our neighbors in New York are at 22.7%. So that's not really great to know, but it's good to know that we are sort of leading some of our neighbors in a big way. So with that, I also want to tell you that at noon today, right across the street at DMV, there's going to be a press conference where I will present the resolutions that you supported this morning. But DMV and New England Donor Services will have a press conference with the Department of Health and people whose family members have donated organs or recipients. And it's a very moving, wonderful way. Everyone is invited. It's well worth the short walk to learn more. Our guests are sitting behind me in the gallery, and I ask you to welcome them and thank them for saving lives of our Vermonters.
Will the guest, the member from Burlington, please rise and be recognized? Member from Poultney.
To add to what the member from Burlington just stated, May 7th, 2015 was my first year here, and it was also the National Day of Prayer. And at noon that day, I received information that my sister was going to receive her new heart. It was a long haul for her. She spent probably about a year and a half in rehab, but 9 years later, she's here still with us. So I just wanted everybody to know that there are personal stories that many of us have here, but this one is especially personal to me.
Member from Bradford.
Thank you, Madam Speaker. In the balcony today, there's Phelan. He's a third grader from Blue Mountain Union, and his mom, Keat. Phelan is one of the brightest and kindest students who regularly attends youth camps at my co-working space. This is their first time in the building, and he made sure that we saw the entire thing. So if you could please help me welcome them.
Will the guest member from Bradford please rise and be recognized? Member from Brandon.
Madam Speaker, along with the members from Chittenden, Orwell, Berry City, and Montpelier, I have several special guests that I would like to welcome to the State House this morning. From Brandon, my husband Brian Jerome, my son Benjamin Jerome, and friends Janet and Joel Mondlack. From Mendon, my sister Peggy Zach. From Sudbury, friends Bruce and Nancy Ness. And from Berry City, my friend Jessa Molaski. And finally, from Montpelier, an Emerge program participant, Palin Cohn. Please join me in welcoming them to the People's House.
Will the family and the guest member from Brandon please rise and be recognized? Are there any further announcements? Member from Burlington.
Thank you, Madam Speaker. Last year I did not do this when she visited, but I'm going to embarrass my 13-year-old today. Grace Willow, also known as G-Dub, is up in the, she's hiding, up in the balcony. And please bother her all day because she'll get bored just being with me. Thank you.
Will the family member from Burlington please rise and be recognized? Are there any further announcements? Seeing none, orders of the day. Members, we will begin with House Bill 504, which is an act relating to approval of amendments to the Charter of the Town of Berlin. Please listen to the third reading of the bill.
H 504, an act relating to approval of amendments to the Charter of the Town of Berlin.
The question is, shall the bill pass? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have passed the bill. Next is House Bill 505, which is an act relating to approval of an amendment to the Charter of the City of Rutland. Please listen to the third reading of the bill.
H 505, an act relating to approval of an amendment to the Charter of the City of Rutland.
The question is, shall the bill pass? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have passed the bill. Next is Senate Bill 36, which is an act relating to permitting an arrest without a warrant for assaults and threats against healthcare workers and disorderly conduct at healthcare facilities. Please listen to the third reading of the bill.
S 36, an act relating to permitting an arrest without a warrant for assaults and threats against healthcare workers and disorderly conduct at healthcare facilities.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have passed the bill in concurrence with proposal of amendment. Next is Senate Bill 48, which is an act relating to regulating the sale of catalytic converters. Please listen to the third reading of the bill.
S 48, an act relating to regulating the sale of catalytic converters.
The question is, shall the bill pass in concurrence with proposal of amendment? Member from Bethel.
Madam Speaker, at the time that I reported out the bill, I was interrogated by the member from Weathersfield as to the number of scrap yards in the state. And the number I gave, which was about 10, was the number that we received as testimony from the Agency of Natural Resources. Subsequent to that testimony, the Agency of Natural Resources has corrected that number to say that there are 60 about scrap yards that they visit 20 per year, so a 3-year cycle. And so I want to correct that for the record.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have passed the bill in concurrence with proposal of amendment. Next is House Bill 89, which is an act relating to civil and criminal procedures concerning legally protective healthcare activity. Member from South Burlington.
Madam Speaker, I move that we postpone action on H89 one legislative day.
The member from South Burlington moves that we postpone action on House Bill 89 one legislative day. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have postponed action on House Bill 89 for one legislative day. Next, we will take up Senate Bill 73, which is an act relating to workers' compensation coverage for firefighters with cancer. The bill was referred to the Committee on Commerce and Economic Development, which recommends that the House propose to the Senate to amend the bill as printed in today's calendar. The member from Castleton, Representative Samus, will report for the committee, and the member from Castleton will move to substitute an amendment for the report of the committee. This substitute amendment is printed in today's calendar. Please listen to the second reading of the bill.
S73, an act relating to workers' compensation coverage for firefighters with cancer.
Member from Castleton.
Thank you, Madam Speaker. Today, I move to substitute an amendment for the report of the Committee on Commerce and Economic Development. This substitute amendment is printed in today's calendar, as mentioned, and it would convert our committee report into a strike-all format and make a technical correction to our report. Our committee's straw poll on this vote for the substitute amendment was 10-0-1. To further clarify, the bill I will be addressing today is Bill S73, an act relating to workers' compensation coverage for firefighters with cancer.
The question is, shall the House substitute the amendment offered by the member from Castleton for the report of the Committee on Commerce and Economic Development? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have substituted the amendment offered by the member from Castleton for the report of the Committee on Commerce and Economic Development. And now back to the member from Castleton for the report of the Committee on Commerce and Economic Development as substituted.
Thank you, Madam Speaker. Today, I would like to address Vermont professional volunteer and full-time firefighters. In the state of Vermont, they are afflicted by cancer at a higher rate than the general population. Workers' compensation, in definition, also known as workers' comp, is insurance that gives employees benefits if they are injured on the job. It also helps by limiting liability for a workplace injury. The workplace of firefighters exposes them daily to the dangers of fires, accident scenes, and carcinogens, as well as chemicals, in order to help save our lives. They are risking not only imminent death from hazards such as those fires, but also sacrificing their long-term health. The occupation itself is listed as a carcinogen. From witnesses in committee, we learned that firefighters experience a twofold increase in the risk of developing thyroid cancer. In addition to this, all genders of firefighters are 7 times more likely to develop breast cancer in comparison to the general population. Firefighters in the age bracket of 35 to 39 also experience 323% higher rates of all cancers than non-firefighters in the same age bracket. While workers' compensation law does currently cover firefighters who develop certain types of cancers from on-the-job exposures, in its current form, it has dangerous shortcomings that need to be directly addressed. These shortcomings are costing lives. Last Friday, House Concurrent Resolution Number 2 honored the memory of a Vermont fire chief. He was diagnosed with lung cancer, which eventually spread to his brain. The fire chief and his family were not only fighting back against his illness, but also against denials of insurance coverage due to the current law not covering specifically lung cancer. The fire chief tragically passed away from his illness without ever receiving workers' compensation. The purpose of Bill S-73 is to help prevent Vermont firefighters from ever having the same experience again. I will now review sections of the bill, and for those that would like to follow, it is printed on page 2079 of today's calendar. Section 1 amends VSA 601. Definitions include the following. Amends definition of personal injury for purposes of workers' compensation to prevent firefighters to qualify for presumption that cancer is work-related in additional instances. Permits firefighters to qualify for presumption if they complete an initial cancer screening while serving as a firefighter and initial screenings indicate no evidence of cancer. Current law requires screening prior to becoming a firefighter. It also expands lists of cancers to include cancers originating in the breast, lung, reproductive systems, replacing the previous language of just testicles, as well as thyroid. It also adds recommendations that fire departments offer or provide annual cancer screenings. Section 2, annual cancer screenings, personal protective equipment upgrades, and report. This requires the Division of Fire Safety to submit a report by January 15th of 2024 regarding the projected costs for state to fund cancer screenings for firefighters and enrollees at Fire Academy. It also lists opportunities for the state to reduce the cost of cancer screenings, along with the projected costs for the state to fund rolling replacement of personal protective equipment, otherwise known as PPE. It also includes opportunities for the state to reduce the cost of replacing PPE. Section 3, workers' compensation for firefighters with cancer, eligibility. This will require DOL and DFR in consultation with the Division of Fire Safety to report on the potential impact of workers' compensation claims, premiums, and lost costs of permitting firefighters who are over the age of 65 or who have used tobacco in the last 10 years to be eligible for presumption that cancer is work-related. It also includes the potential impact on workers' compensation claims, premiums, loss of costs of expanding cancer presumption to either additional types of cancer that occur more frequently in firefighters or that are caused by carcinogens firefighters are exposed to, or all cancers. Potential methods for appropriating liability when a firefighter works for or has worked for more than one department. The bill, my apologies, I skipped my list here. It's my first time. In committee, we received a witness testimony from several groups and organizations and individuals. The witness list includes the Director of Workers' Compensation and Safety from the Department of Labor, the Deputy Commissioner of Insurance from the Department of Financial Regulation, otherwise known as DFR, the Director of Risk Management Services from the Vermont League of Cities and Towns, the Director of Fire Safety Division from the Public Safety Department, the President of the Professional Firefighters of Vermont, the Manager of Workers' Compensation Claims from the Vermont League of Cities and Towns, the Chair of the Vermont State Firefighters Association, our Legislative Counsel from the Office of Legislative Counsel, the Director of Science and Research from the International Association of Firefighters. This bill has passed out of the Commerce and Economic Development Committee unanimously with a vote of 11-0-0. Today, we humbly ask for your support in the passage of this bill. Thank you.
The question is, shall the House propose to the Senate to amend the bill as recommended by the Committee on Commerce and Economic Development as substituted? Are you ready for the question? Member from Pittsford.
Thank you, Madam Speaker. I'd like to thank the House Committee on Commerce and the Senate Committee on Commerce and Economic Development for this bill. This bill has been lingering around this body, interrupted by COVID for the last few years, and is extremely important to me on a personal basis. I've been involved in the fire service for 54 years and I'm still active. Through that time, I've lost a friend, a close friend, to pancreatic cancer, a healthy individual. I lost a very young friend from a neighboring department with testicular cancer after he'd been in the fire service about 8 or 9 years. He was 35 years old, left 2 small children and his wife, and most recently lost a friend and a chief from a fire department in Virginia who had served his community proudly for over 20 years. Firefighters are your forgotten heroes. When you're in trouble, you call the fire department. When you're not, we're just there in our red trucks. This is an important health issue that we have in the fire service, and I'm glad to see the study come forth for talking about other cancers that may be available, talking about possible state funding for testing for firefighters, and the like. This bill will also serve as a recruiting tool, especially for the volunteer companies throughout the state of Vermont that are having trouble filling spots because of various things going on, but also because of the potential of developing a very serious and career and life-ending disease. I look forward to hearing about the safety improvements and this lack and the additional funding to help all of our fire departments replace their turnout gear, which is our first line of defense against these cancers. So, Madam Speaker, with all of that said, may I interrogate the presenter of the bill?
The member from Castleton is interrogated.
Madam Speaker, just want to confirm that we have swept in all existing firefighters currently serving either on a volunteer company or on a career department that would be eligible for this coverage now.
Madam Speaker, I would like to yield to the member from Coventry, please.
The member from Castleton yields to the member from Coventry.
Thank you, Madam Speaker. Yes, you are correct, member.
Could you try it again, Madam Speaker?
Madam Speaker, you are correct.
Thank you. And Madam Speaker, when you were talking about coverage for firefighters and you have restricted somebody, have you potentially restricted somebody from coming in from out of state, joining a career or a volunteer organization, and then developing a career in life-ending cancer disease, but yet served maybe 4 years in, say, New York and 1 year in Vermont. Would that be, is that a restriction that we should need to look at?
Madam Speaker, I don't know that we took testimony as to firefighters that would be coming from another state becoming a firefighter in Vermont. My understanding would be that their workers' compensation would cover them if they were a firefighter in Vermont. I think the insurance companies may work with the Department of Labor and with the Department of Financial Regulation as to who participates in the payments of workers' compensation, but I believe that that firefighter would be covered under workers' compensation in Vermont.
Thank you, Madam Speaker. And I'm going to ask the question, why do we originally exclude firefighters over 65?
Madam Speaker, that was in the original language of the bill in 2008. I think at that time, there were, I don't think that that was an issue as much as it may be now, especially with our professional volunteers, where those departments are having a harder time bringing new members on. And so members of the department are staying on longer and retiring later. And so we need to look at that to make sure that if that is happening, we want to make sure they're covered as well.
Thank you, member. And Madam Speaker, I'm encouraged by some of the items in the study committee that will address that, and I look forward to hearing that answer. But all in all, this is an extremely important bill for all Vermonters, and I certainly will support this. And Madam Speaker, thank you.
The question is, shall the House propose to the Senate to amend the bill as recommended by the Committee on Commerce and Economic Development as substituted? Member from Coventry.
Thank you, Madam Speaker. I just want members to know that in 2008, when we passed the underlying statute, that one big change that we made was the presumption. So currently in workers' compensation, the presumption that you're injured on the job is the employee's, it's up to the employee to prove. In changing that in 2008, we actually reversed that presumption. So it's presumed that you receive the injury if you're a firefighter on the job for those specific cancers. It's a rebuttable presumption, but nonetheless, it takes the pressure off those firefighters if they come down with cancer that's part of the list of cancers that we've included. So that's a big difference, and that continues on now through this bill as well. So it's something that we did a number of years ago to recognize how important our firefighters are and how important it is for us to take care of them. Thank you.
Are you ready for the question? Member from Burlington.
Madam Speaker, may I interrogate the presenter of the bill?
Member from Castleton is interrogated.
Madam Speaker, I'm curious why use of tobacco products is singled out as barring a firefighter from the presumption under current law. I see that it's in the report. There's supposed to be recommendations about amending or repealing that, but I'm curious if any testimony was taken about why use of tobacco products within the last 10 years bars a firefighter from the presumption.
Madam Speaker, we did not take testimony from that, but one thing that is known is that many fire departments do require pretty extensive physical training and physical training standards for their firefighters. And in addition to that, for insurance companies, tobacco products are a known carcinogen, and it would limit the liability for the insurance companies.
Madam Speaker, did our committee hear any testimony about why tobacco products are singled out but not other carcinogen exposure? For example, coming from a community whose drinking water has been contaminated, or people who went to a school that's been contaminated?
Madam Speaker, we did not receive testimony in regards to that subject.
Thank you, Madam Speaker. I ask these questions because I do support this bill, but I hope that moving forward, we can be thinking bigger and thinking about all of the various factors that contribute to illness of frontline workers who put their lives at risk to serve the community. And I'm hoping that we can not only look at cancer, but look at other illnesses that people are facing, such as autoimmune disease or PTSD. And hopefully we can also, if we're going to judge people because they use tobacco, hopefully we can also make sure that we're providing every possible resource for people for smoking cessation and other minimizing other risks of exposure to carcinogens. Thank you.
The question is, shall the House propose to the Senate to amend the bill as recommended by the Committee on Commerce and Economic and Development as substituted? Member from Pittsford.
Thank you, Madam Speaker. I just would like to thank the Commerce Committee again, something I forgot during my speech there. When I first came into this building a few years back and we talked about firefighters and EMS people, we talked about the professionals and the volunteers. It's been a quest of mine to make sure that we are all professional firefighters. And I heard the committee in the report of the bill call out that we're career firefighters and professional volunteers. And I want to thank you for that. And if my quest to have that distinction that we're all professional firefighters sounds like it's taken hold, and I want to thank the body for that and the committee.
Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have proposed to the Senate to amend the bill. Now the question is, shall the bill be read a third time? Are you ready for that question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and third reading is ordered. Members, that completes the orders of the day. Are there any announcements? Member from Wolcott.
Thank you, Madam Speaker. The Older Vermonters Caucus will meet tomorrow in room 270 at noon. Treasurer Pichek will be joining us to give an overview of his retirement savings program called Vermont Saves. I will send out a link to a Zoom link also. Thank you.
Member from Burlington.
Madam Speaker, I have been charged by the member from Chittenden, who is not with us today, to announce that the end of session pool ends today. Your entries are due by 4 o'clock, and you can register your vote in the clerk's office. Thank you.
Member from Poultney.
Madam Speaker, House Republicans will meet 15 minutes following adjournment in room 267 of the pavilion.
Member from Newfane.
Madam Speaker, Democrats will caucus 15 minutes after adjournment in the Pavilion Auditorium.
Member from Burlington.
Madam Speaker, House Progressives will meet in the Pavilion in room 270 at noon. And today we will be joined by Let's Grow Kids, also Vermont Businesses for Social Responsibility, and Voices for Vermont's Children to explore childcare policy in large, including paid family leave. All are welcome. Thank you.
Member from Rutland City.
Thank you, Madam Speaker. Tomorrow at noon, the Working Vermonters Caucus will meet at the Pavilion. Everyone is welcome to join us. Wonderful lunch will be served, and we hope to see you there. Thank you.
Are there any further announcements? Seeing none. Member from Poultney, can you please offer us a motion to adjourn until Wednesday, April 26th at 1 p.m.?
Madam Speaker, I make a motion this body stand an adjournment until Wednesday, April 26, 2023 at 1 p.m.
You have heard the motion. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and this body stands in adjournment until tomorrow at 1 p.m.